my name is Brittany Payne, and this is my disease project. My disease project is over Leptospira interrogens. Topics that we will be covering are: what is Leptospira, what is the structure of Leptospira, the pathophysiology of Leptospira, and who is at most risk of getting Leptospira, treatments of Leptospira, and methods for prevention. What is Leptospira? Leptospira is a bacterial disease caused by the genus Leptospira. This disease can be spread from rats and rodents, urine, along with infected water. This bacteria is known to cause the illness called leptospirosis. This disease can vary from a mild to a very life-threatening case. The structure of Leptospira. The bacteria is a corkscrew shaped with spiral or hooked ends that look like a question mark. It is an anaerobic spirochete that continues to grow longer and multiply. The bacteria contains a layer of peptoglycan, and the outer layer is the outer sheath. The bacteria also has a cytoplasmic membrane. The bacteria is so thin that it is not easily seen with an ordinary microscope. The virulence of Leptospira. The virulence of Leptospira interrogens can be related to leptospiral LPS, which is noted to trigger macrophages in response to infection. Also, LPS is overall virulence factor for gram-negative bacteria. Leptospira are able to store and associate fatty acids with their endotoxins GLP and LPS. CLPB holds the biggest role in the bacterial virulence. It helps by aiding the bacteria to survive inside its host, and it also helps to control the stress responses. This disease can go through intact mucous membranes or lacerated skin, then enter through the bloodstream and multiply to react with all of the other parts of the body. The toxicity of Leptospira. The toxicity of Leptospira can affect the eyes of the host, the organs, the skin, and the cerebral spinal fluid, CSF. Many cases of this disease are mild, but without treatment become fatal. The host may become jaundiced due to liver damage and can also experience renal failure from leptospiras directly on the tubules. Lastly, meningeal irritation can be seen when leptospirals go into the host of spinal fluid. How the disease interferes with normal pathophysiology. The disease leptospirosis has different phases of illness. The incubation period, which usually lasts about 7 to 12 days. In this time, humans show symptoms of general malaise, muscle pain, nausea, and a sudden onset of fever with congestion. During the second phase, the enterocyte phase, which can be up to 30 days, fever subsides and the antibodies emerge, and swelling of the eyes or uveitis happen. Meningeal inflammation, renal tubular failure, and a rash may develop. This is why it is so important to seek medical help immediately. Which populations are most at risk for developing this disease? Leptospirosis is spread in the United States by dogs, rodents, cats, and the most common rats. Humans are not the intended host for this disease, and human-to-human transmission is rare. The most likely people to contract this disease are those living in a tropical or humid climate areas. Occupations or activities that are most likely to contract this disease. Usually people who work around water, those with agricultural careers, those who participate in recreational outdoor sports. Some examples of these are sewer workers, dairy farmers, slaughterhouse workers, vegetarians, military personnel, and mine workers.
So Monday.
The socioeconomic classes that are most at risk for developing the disease are the low income and rural and urban areas, most commonly those with lack of ability to cope with floods, or those who cannot prevent rodent infestation. The significance of leptospirosis on the community is that the disease can affect water, soil, and animals, which can affect drinking water, food, people in hurricanes, and people's homes. One treatment trend that is commonly used in the management of leptospirosis is antibiotics. Antibiotics for leptospirosis are very important. They can decrease fatal outcomes, shorten disease time, and one treatment for leptospirosis that includes a pharmacological intervention is the use of oral antibiotics, taken 3 times daily for 7 days to prevent furthering or spreading of this disease. Main antibiotics that are used for these are penicillins like amoxicillin, ampicillin, doxycycline, oral antibiotics, and these must be given in the first 5 days of the disease, and the antibiotic regimen must be followed. For more severe cases of leptospirosis, intravenous corticosteroid therapy is used for more severe cases. 4 out of 5 clinical trial studies were shown to show improvement with intravenous corticosteroid therapy, reduce the spread of this disease, and reduce pulmonary involvement. Steps to be undertaken for prevention of infection of leptospirosis. You should avoid wading or swimming in any water that may be contaminated with mammal urine or infected animals. Try to control the amount of rodent contact and rodent population around and in your house, work, or barn or farm. Wear protective clothing when being exposed to contaminated water or soil due to a hobby or occupation. Thank you. I think I'm gonna have to